I love you.
I love you. Don't get so special. Always get so special.
Vernon, how are you today? It's okay? Happy Friday.
Is it recording?
So I don't know if you remember, 8 years is a while, but when the baby's born, we commonly these days often let the baby deliver and wait for a minute or so with the baby still in your tummy there before cutting the cord. We used to do it right away because it's called delayed cord clampings in both these days. So, you know, if the women have asthma, they'll just put their baby up on the woman's chest and then clamp the cord. For a C-section, that's not possible, so we just leave the baby there. We'll hold the baby up and you can see and so on. Then they'll cut the cord. The baby's going to go over there where Teresa is for the first 5 minutes or so she can check things out, make sure all's good, get those Apgar scores and stuff, and she sure can go back and forth, whatever works for you guys. Yeah. It's a great day to have a birthday, isn't it?
It is.
So all the kids that have been born this week, they get their birthday party, and as soon as they're over that, it's Halloween, and exactly. Yeah. It's going to be crazy, the end of October, November.
Oh, yeah.
Yeah.
I feel huggy.
Yes, that's Dr. Henderson, Dr. Jernigan doing good stuff there.
Love you. You want me the baby?
I can't believe it. I feel like it's been long, but it's been short.
I think they're ready to pull it out. I don't hear her crying yet.
Blood pressure, more than my arm. He asked me what channel of Pandora. I was like, I have no idea. I didn't anticipate to answer a question like that.
Yeah, well, I played with the paste one, so we had the Cat Season station on because that's my last lady one, and we went for the 2000s, pop radio thing.
Yeah, all right.
Yeah. Or if you guys don't care, I'll put on what I like, you may not. We save that for when patients are under general anesthesia. We listen to what we want. We don't inflict that on our patients. Although, quite honestly, I've had women having C-sections who want to listen to pretty much everything you can imagine. Perhaps things you can't. I had a lady who brought in her own tape music, and we got to listen to Marilyn Manson for an hour. Yeah. We were so excited.
Yeah, I'm sure, yeah.
Dab.
Yeah.
Our nephews are in the band, and it's called Dab.
Dab,
And
okay.
it's a hard,
Hard rock.
punk
Pop.
rock.
Yeah.
Mm-hmm.
And me and my husband like R&B and pop music, and he likes rap. But this is not. And then I was like, whenever I was like, yeah, I put Dab on it. And Marilyn Manson and all of that.
Okay, yeah.
Such a weird feeling. It's like holding and hugging, but I can't feel it. I just feel the.
This is way different because before, remember it was like right above your belly, the sheet thing, and it was only a little tiny one.
Yeah.
I think probably most places these days.
Or maybe because I was standing.
No, well, that's possible.
Yeah.
But no, it certainly could have been lower.
Yeah.
That's quite possible. With this, see, as you can see, with this clear plastic thing, it goes up there. If I lower the whole thing, then the whole drape is down. You can't see, so I have to put the clips up high
Oh, yeah.
to have this here. But we're also, I think everybody is concerned, has always, but really even more so concerned about infections.
Right.
So everything we can do to make a nice barrier and keep all that stuff there and keep us sure we don't want to send any germs over to that side and potentially cause an infection afterwards. So we transited to a higher drape And we used, when I first started, we'd have a little thing that was like this.
Yeah, that
was it.
That's what we had last time, just a little tiny.
Yeah. Then we went to a bigger one, and now we're going bigger and higher. It's just, I've been doing this almost 30 years now, and it's getting bigger and higher.
Now, it's normal. I always feel like tugging on the right side.
Yeah, she has pretty good adhesion to her hands. So just
So it's probably a combination of two things. Because remember I told you that there's a little bit of sugar in there that makes your anesthesia go a little bit more to one side or the other, and I think you tilted a bit to the left, so you may be a little more numb on the left. When you've had surgery before, you can get some adhesions, some scar tissue. Not to say you got some pretty good adhesions. And perhaps those are more on the right hand side, sometimes they're more on one side than the other, and so they have to do more work on one side. If you don't have adhesions or a woman having her first C-section,
What's adhesion like?
things stuck together, scar.
Okay.
Whenever you have surgery, the way the body heals, you get an inflammation, and then things, heal. And sometimes things can stick together that aren't normally stuck together. And so it means for the surgeons, they have to be very careful, which they are, it's not a problem.
Right.
But just because things can be stuck down that aren't normally stuck down, it just makes their job a little bit more challenging than it is otherwise. So, again, you're in excellent hands here. All's good.
Yes.
I think a lot of surgeons sit there and they look at ladies having a fourth C-section and they tremble. They say, what am I going to find? You had so many operations where you've had, 2 C-sections and appendix. You had your appendix out, you had your gallbladder out. The surgery can be quite challenging sometimes.
So open out, you're like, wow, I don't know. You don't know what to expect.
Correct. And sometimes it's normally where you cut through something and then you get to the next layer, so it's opening and then things slide. Well, things don't open. They don't slide. So then, you got to be careful. You don't want to make a cut in someone you want to be cut into. So it just takes longer. Then, you've got some hands and they're turning their excellent. So, they'll just take the time and do the right thing. It's not a problem.
Good.
This is what happens when you've had more than one operation before. Yeah.
What?
Justin Timberlake is on.
Oh.
Is that good?
That's good.
Okay. You still have a crush on him?
Yeah.
Yeah.
Okay, all right.
My daughter's like, that's your boyfriend, Mommy.
Okay.
He's going to be in the Super Bowl this year.
Okay.
Yes.
They seem to alternate between the, recent past stars and the almost dead ex-stars. It was only a couple years ago that Tom Petty was there in the Super Bowl, right?
Yeah.
It was only a couple years ago, and now he's gone. Yeah. He's a young man.
What happened? Why did he take so long?
I don't know. I heard he looked pretty ill when he was here at Kaboom,
Yeah.
and 2 weeks later he was dead.
Wow.
It was pneumonia or something. Maybe that was somebody else, I don't know.
Yeah. It wasn't clear to me what he died of.
Yeah, I don't think they made it public.
Yeah, that's
Today, you don't expect him to die.
Yeah.
Benson passed away.
Yeah.
What's his name?